Welcome to the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Hey everyone, welcome to the episode of the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero, and today we're going to talk about meniscus tears. Right? This is something that a lot of people can relate to. It's very, very common, in the knee as far as like your pain that you're having and the symptoms and all that. And so once we kind of go over a few things, it's pretty easy to spot in a lot of cases. So basically the meniscus acts like a shock absorber in the knee, right? It's like this cushion in the knee. And it's made up of a type of cartilage. And basically what happens is the meniscus has a poor blood supply. And the farther inside you go in the meniscus, closer to the center, the blood supply is even less. So, when it is damaged or becomes aggravated, it takes a long time to heal in a lot of cases. And, years ago, they would just, there's some studies put out that they would just remove the meniscus, the entire meniscus, if it was damaged, just to kind of see if how that worked out. And in these studies, almost everyone had, like advanced osteoarthritis that developed after they took that shock absorbability out of the knee. So that's not really a good idea. So we'll kind of go over what they do on that and, how they treat it and all those kind of things. So. But again, the meniscus is a shock absorber in the knee, and you may be, walking across the yard. Very common. People step in a hole, twist the knee, may feel or hear a pop. You may have, hyperextended the knee. Maybe you fell and the knee twisted back underneath you, and there was a rotation to it as well. And then you have this inability to straighten out the knee. Now, usually. If it's where you don't have the ability to straighten it out, let's just take the ACL and things like that out of the equation, right? We're just talking meniscus right now. And if you have the inability to straighten out the knee, you probably have a piece of the meniscus, a flap that's sticking up, that's getting caught. And that's very common with something called bucket handle tears, where you have this little piece that sticks up, and in most cases, it's going to have to be cleaned up, removed, or sutured down, those kind of things. But you may be walking across the yard, you stepped in a hole, you twisted your knee. It may be a situation where you stepped out of the back of your truck or something like that. I actually had a patient one time, was putting a full gas can. They were going to mow their yard and rotated to put the can of gas in the back of the truck, and then bam, felt this pop in the knee, sharp pain, and then kind of the rest is history, ended with a meniscal tear. And so it's usually one of those types of things. Or maybe you have not been walking or running, and then you decide to take up walking or running and you irritate it, because you can just irritate the meniscus. Doesn't necessarily have to be torn. So anyway, a couple things there that you could have, a few things there you could have that could be going on that could aggravate it or cause the symptoms in general. Of course, there's always a traumatic blow to it. A football player, soccer player getting hit from the side or something like that, or the knee gets impacted and you get like hyperextension of the knee. Those types of things can cause it too. But just for the general person out there is maybe not an athlete, it's like, I don't know what's going on. You usually will have pain presentation, not always, but it will kind of present. If you took your hand, like your index and your thumb, and you made the letter C, okay, and you go just below the kneecap, okay, and you put your hand around your leg at that point, that usually is where the pain presents, either on the front part in the C or in the back part. Almost it's one or the other usually. And people will say it feels like there's a knife stabbing in there. Again, there's a catch. May hurt to load weight or put your full weight on that side. And so they'll usually present with that. There can be some localized swelling. Sometimes, there's not just a ton of swelling because, again, the meniscus is avascular, does not have a large blood supply. So you may not notice a whole bunch of swelling in the area. Usually an inability to extend the knee all the way, get the knee down flat, is uncomfortable. And there are some tests that you can do. Your doctor or therapist or whoever, trainer, can do these tests. Kind of the go-to is the McMurray's Click. That's a test that's done, the McMurray's Click test. A deep knee bend. It's just literally, you're taking the foot, and you're bending the knee all the way back. And you're trying to make the foot go as close to the butt as you can, and see if that reproduces pain or they're unable to get to that position. And there's Apley's compression test, and there's a couple of versions of that, a couple of different ways you can do that. And so that the person's on their stomach, and there's the knees bent, and there's rotation of the tibia on the femur, and then also like with compression or with distraction. So there's just some different things there that you can do. And of course, as always, like when someone comes in and they got the knee pain like that, I would run through all my tests if I suspect, or just even check, MCL, ACL, PCL, LCL, of course, and then you're checking patella and all these types of things. So I would look at all those things. But again, let's just say for the sake of this podcast that we've checked all that out, and we do think it's just meniscal related. Okay, so what do I need to do? Okay, I think I have a meniscal tear, because initially most insurances are not going to let you go and just have an MRI. That's you're going to get an X-ray, which is, if it's meniscus, probably not show anything other than maybe some swelling, maybe visible on there. But they're going to make you, in most cases, you're going to have to go to therapy. Not always, but in a lot of cases, you're going to have to go to therapy first to see if the therapy helps or not. And so you're going to therapy, and let's say that it helps, because there's a lot of research that supports if you do enough, progressive strengthening and then also loading on the meniscus, then you can resolve the issue in a lot of cases without having to have surgery, but not always. I mean, there are sometimes you just have to have surgery. It's just not going to get better. But a study that was published, this has been a while back, and I don't even remember the study off the top of my head, but they looked at people that had meniscal repairs and with meniscectomies, where they take portions of the meniscus that's damaged out, and or just like surgical repair where they suture down the flaps and things like that and do a little debridement, kind of clean everything up, versus people that had no meniscal, no surgery, and they just went to therapy. And at the same point, at like 12 months, and I think again at like 18 months, they were at the same point, most of them, with regards to satisfaction with recovery, and then pain, range of motion, return to functional activity. But the people that had the surgery, they did better faster. So, I mean, obviously, most of us are not a sit around and wait type. We're not sit around and wait type people. It's just not how most life is nowadays. So, like, everybody's go. So you gotta have this stuff fixed. So in a lot of cases, people ask, Chad, do I need to have surgery? Do I not have surgery? It's like, what's your opinion on it? And it's like this. I mean, I try to avoid surgery when you can, but sometimes you just can't. And especially if you need to get back into your sport or back to work or even just back to life in general faster, then it's not a bad idea, to have the surgery. It's arthroscopic, so just make little portal holes usually, and then follow up with some therapy, and make sure that you do good strengthening exercises and motor control exercises and all that types of things, and really listen to your doctor and your therapist as far as do's and don'ts, what you should be doing and not be doing. You should do really well. All the ones that I've seen over the years do really, really well, with no issues. But again, that comes down to the biggest question. People's like, do I need surgery or not? Well, I mean, again, and this was just one study, and then just based off of my career, what I've seen, I think it could go either way. I've seen people do really well without it, but then I've seen people, I mean, you don't want to be 2 years later and it's still bothering you. You're like, shoot, I should have got this thing fixed a long time ago. So that is something to think about. But if it were me, honestly, and I had a meniscal issue and it was impacting my ability to get around and walk and do my day-to-day stuff and work and all that, I would personally probably have the surgery. And I'm not saying everybody go have surgery. Obviously, the disclaimer is make sure you talk to your doctor and all that kind of stuff and discuss all these things, right? But just for me personally, I probably would, and then follow up with therapy, and then would do really well and recover nicely. So anyway, so that's a little bit about meniscus damage or, and then kind of what to expect or what you should do. Oh, and the other question people ask is like, how long is therapy? And that depends. It depends on the patient, depends on the surgeon, the insurance, the therapist. A lot of times I just tell people, like, just work on it. And, if the therapy, place that you're going allows you and your insurance is covering it, go as long as you can. If you can do that and your doctor's okay with it, go as long as you can, because the more strengthening that you do and the more motor control you develop and all those kind of things, the better off it is, and the better off you are, just generally speaking, right? So anyway, thanks so much for listening, guys. I appreciate it. If you would, please rate me 5 stars wherever you listen to this podcast. Thank you guys again, and you have an awesome day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.